Today marks 382 days since our first case of COVID-19 in Albany County. Believe it or not, we're in week 55 and continuing. Thank goodness there's no new people that passed away last night to COVID-19. Unfortunately, we did have a man in the 60s on Saturday pass away, and that was the first one we had in 2 weeks. So, my condolences and prayers go out to the family and go out to all the families that lost loved ones, not just the COVID-19, but through this difficult 55 weeks we've been in. So as of today, there's 22,206 cases of COVID-19 in Albany County. We have an increase of 61 positive cases since yesterday. The day before that was 83 new cases, and the day before that was 74. So we started to go up, down a little bit more. The 5-day average is 73.6, and the day before that was 73.4, which we have going up a little bit. There are currently 1,392 people under mandatory quarantine. Yesterday it was 1,400. Out of the new positive cases, we had 24 had close contact to a positive case. 1 was a healthcare worker, and 3 reported traveling out of state. 33 didn't have a clear source of infection. As of today, there's 21,639 people that have tested positive for the virus and have recovered. That's an increase of 45 recoveries since yesterday. Unfortunately, we had 2 new hospitalizations overnight. There are now 28 people currently in the hospital from the virus, and the day before that was 28. 2 patients currently in the ICU, and we had 1 the day before. If you look back at the 10 days, you can see a concerning trend in our numbers, and I think partially because people are letting their guard down a little bit. Spring break's here, weather's changing. It was a little cold today, a little snowflakes going on, but for the most part, we've had some good weather the last couple of days. And unfortunately, we're coming upon, we just had Palm Sunday. We have people going on spring break. People are going early. People are getting ready to leave. People already went to spring break. Please, just because you got your first dose doesn't mean you're fully vaccinated. And Dr. Whalen can talk about this. It takes 3 weeks for your first dose to really give that effectiveness of the vaccine, and then your second dose. And I know some people are going out and they're starting to drop their masks. They're starting to let their guard down. The light's at the end of the tunnel, but we're not there yet. So please be cautious. And I'm starting to see a lot more people now getting relaxed. And now if you go around, you see them hanging out like this with the mask under their nose. And again, we're starting to get complacent because it has been a long 55 weeks. We're almost there, people. We need to stick into this together. Our Albany County 7-day average percent positive rate is 2.3. Just south of us, Greene County's 3.9. 10 days ago, and our 7-day average was 1.8%. So we're starting to creep back up in the wrong direction. When we're seeing in our hospitalization numbers too, back on March 18th, we reported the lowest number of county residents in hospitals since October the 28th. Hospitalizations hit 34 this past Friday. It's not just here in Albany County in the capital region. We're seeing infection rates spiking downstate in New Jersey, Vermont, Michigan, and others across the country. New York, New Jersey are now number 1 and number 2 for the highest infection rate based on population. So we have to be concerned with that. Please continue to wear your mask out in public, cough into your arm, clean your hands, stay 6 feet apart. We're going to get through this. I'm not trying to alarm anyone. We just got to be careful. If you look at our people in that age group that identified early on, God, Dr. Whalen and I forget how long ago it was when we started doing the chart and we showed the 18 to 30-year-olds in the trend before anyone else was talking about it, how that is the most, in fact, that number was growing and started to beat out any other age group, and we're seeing that more and more. So people got to remember 20% of our population falls between 18 and 30-year-olds, and so in people under 18, it's like I think 18.3, don't hold me exactly to that number, but they're the ones that are getting infected. They're the ones going to college, spring break. We need you to do your job and get vaccinated, and do the right thing. If you want to see if you're eligible, please call 1-833-697-4829 to see if you're available for eligible to get the vaccine. There's still available appointments at UAlbany, the vaccination site, and the last time I checked Albany County, we're doing more first doses this week than the last time. You can call United Way at 211, and if you're still having issues, our hotline, getting help to have people navigate the website, which I know people are still having that issue. To date, one of the things our administration reallocated 32,521 first and second doses with J&J single shots. Through our vaccine clinics, Albany County has administered 21,738. Good job, Dr. Wellens, you and your team as always. We also been partnering with a lot of different people, and I don't want to stay here because I'd be reading for the next hour, with Mohawk Ambulance, Alliance for Better Health, the Albany Public Libraries for the vaccine pod in Arbor Hill this weekend. We had 635 people that got vaccinated on Saturday. And one of the numbers I keep watching, right, as if people watch their stocks, this is a number important to us because the closer, once we get to 70%, we can hopefully then start, get away from masks and get back to some type of normalcy in our lives. Right now, we're at 36.1% of Albany County population that has received one dose of the vaccine, and it's estimated 20.3% have been completely vaccinated. Compare that to a statewide rate, first doses administered, 29.2%. So, basically we need to get to another 34%. To hit that 70, and as you're seeing the mass rollout of vaccine, we're getting more vaccine than we ever did before. Other people are, but the problem is it's getting harder and harder to fill. We're all competing for that age group. I've said this. CDC says one thing with the priority list. Our state has it at another for the priority list. But again, it's. I've said it before, it turns into like the Hunger Games. We're all trying to get the same group, or I can only vaccinate a certain group, and we can't go outside that group, or we'll get $1 million fine or lack of vaccines. So I am advocating again today to just open it up to everyone who needs to get the vaccine. It's time, Governor, it's time to open this up to everybody because, look around us. Most states are going to April 15th. We had people that we've always had the demand. We didn't have the supply. We have the supply. And, we need to get to them age groups to open up. The reason why I read about the other populations, the other age groups of kids that are out there not doing necessarily the right thing. Colleges are back. Kids are on spring break. Kids will be coming back. We need to get the vaccine in arms, and we need to get away from this list of saying you're eligible, you're not eligible. I have advocated, I fully believe why we did hospitalizations, 1A people, people over 75. We advocated 4 weeks ago, somewhere in that time frame, for people with underlying health conditions. We had to do teachers. We had to, do different things. Now it's time. It made no sense, and I'm not going to get into the other ones we opened it up to. But it's time to open it up. We need to get these kids in here. That's why I said that, that 20% of our population between 18 and 30, they're the ones that, that are carrying the vaccine, and we need to do this. We at least need to lower it down to, let's get past 50. Let's get into the 40s and 30s. Let's just open it up and let Dr. Whalen and her team figure it out, and I can assure you, we don't want to turn vaccine back. We get 7 days to get all vaccine out. And if we don't, we get penalized, and we get lack of vaccine. But when you say, here's 1,000 doses, but we're only going to give you a population of 700 to go from, it makes it difficult. And when Rensselaer County is doing the same thing, Schenectady County is doing the same thing, I got everyone else in the city going after the same age group. It's just time. It's time as this vaccine rolls in and we get more. And I know President Biden pledged he's going to get more vaccine out. It's going to come to a point, and it's getting there, where we're going to be looking for people on the street to walk in and get a vaccine. So please, let's open this up. Let's open it up to all these kids, and let's get this done, Governor. Let's get these shots in the arms that we need to. So one of the things I'm going to plead with everyone, go to our pre-registration site. It has worked. It's been effective. We're running out of names, but the names that are left on there, and I want to say this to the people, I know you called my office. I apologize. You're not in that age or that bracket where we can authorize a vaccine to you. So yes, we get to everyone on there. In Arbor Hill alone, we filled every one of them slots through the pre-registration. every one of the 650 shots or so were from that pre-registration. We're not the only ones using it. I actually had a good conversation with Steve McLaughlin over the last 3 days. They agree they're going to use our pre-registration. I got to get confirmation from Schenectady County, so we're all using the same pre-registration. Their residents can sign up. We can draw from each other's pods and make sure we get the shots out, because again, it's not a competition between my county and the other counties. It's about taking care of everyone. We're all one big family in the capital region, and it benefits us as much as every shot in this county versus every shot in Rensselaer County that Steve gets in an arm. It means one day of getting back to normalcy, one more day of getting out of this situation where we can get back on with life and everything else. So please go to our pre-registration. Even if you finally got someplace else that's a month from now, if we can get you in sooner, you get in sooner, and we'll get there. Go to albanycounty.com. You can see the red bar across the top, which will take you to our COVID page, and pre-register there. Dr. Whalen.
Good morning. So, as the county executive indicated, we're watching our numbers very carefully, and we have seen some evidence that we're not continuing to see a downward trend, and are concerned that the numbers could start to tick up. There are many reasons for this concern, but the two primary reasons are the increased prevalence across the country of COVID variants that are more highly contagious, and the more important, or just as important, relaxation of mitigation efforts. So again, as we have said for more than a year now, it is essential for people to continue to do their part. It is essential for you to continue to wear your mask, to continue to social distance, to continue to avoid large gatherings, and to practice frequent hand washing. And if you feel sick, stay at home. It is a season we're starting to see, a little bit of people complaining of colds or allergy symptoms. Please be reminded again, even if your symptoms are mild, you should be tested for COVID-19, and that testing is essential to controlling the spread. So all of these things that we have discussed since the beginning of this pandemic are as important as ever. We are currently in week 16 of vaccine, and I'm very pleased and proud of our team at the County Health Department that we have vaccinated more than 20,000 people in our clinics, and with partners have gotten out more than 30,000 vaccines. So this is a Herculean effort, and our team is working around the clock to continue this important strategy. And this is really what's going to get us to the end. And I'll say right now we're at a race. We're at a race because we know in other parts of the country we are seeing higher rates of COVID. We know that is a concern that could hit us here in Albany County, and we are racing to vaccinate people. So I think that we are in a good position in Albany County, and certainly looking at our numbers for the capital region, we are ahead of the curve for vaccination in the state. So that is good news, but it's not a complete reassurance. We need to continue to get the word out for people to be vaccinated when their time comes. When you are eligible for vaccine, sign up for vaccination. This week, we have an additional supply of 1,670 doses of Pfizer and 1,300 doses of Moderna that we are going to be looking to get out. We are still waiting to hear if we'll receive an additional shipment of Johnson & Johnson. As is the case for every week, once we get the vaccine in, we will be able to plan our pods. But this week, as opposed to other weeks, we are told that this will be a consistent supply that we will get for weeks 17 through 20. So this enables us to start planning with a little bit more leeway than the quick turnaround of a couple of days that we've been operating on so far. And we hope that this will enable more people to be able to sign up. The pre-registration is important. If you are eligible or not, please pre-register so that we know that you're interested in getting vaccine and we can get word out to you when availability opens up to you. There are many partners in the Capital Region that are currently working on vaccine, including the large state pods at UAlbany and at the Armory. And we have partners in pharmacies that will be receiving doses this week, including Johnson & Johnson doses. We also know providers are starting to get vaccine. So these are very many ways that we can look to get vaccine out. And again, the message that vaccine is safe and effective is essential in the population. Both the county executive and I have been vaccinated at this stage. We have encouraged our family members to be vaccinated, and we are encouraging the general public to be vaccinated. I agree with the county executive's advocacy for opening up availability of vaccine. Throughout the COVID pandemic, as we look at our numbers of positivity, we know that the younger age group, the college age group, and those past college up to age 30 usually are our highest rate of positives. Now, we know that they have a lower rate of hospitalizations and deaths, but they are very capable of spreading COVID to relatives that may be at risk. This is the age group that we have focused our mitigation efforts towards. And as availability for vaccine opens up, it is essential that this population be vaccinated to stem the spread. This is particularly important in this particular season. We are in a holiday season and also spring break season. And there are other parts of the country where people may be traveling to that are not as stringent in terms of mitigation efforts. Please know that if you're traveling for spring break, there isn't a part of this country that you can go to that's COVID-free unless you're going to a completely isolated cabin where you will see no one and interact with no one on a vacation. You will be at risk of interacting with someone, and you could be at risk of bringing COVID home. So please act appropriately, and please maintain mitigation strategies. Also, as the county executive indicated, it's important for people to know when you are vaccinated that you need to be fully vaccinated for you to get to a stage where you have a level of comfort of interacting with other people that are fully vaccinated in a home situation or a visiting situation where you are in an area where you can be unmasked. This is 2 weeks after your last dose of vaccine. So if you have if you have a Pfizer vaccine, you'll get a dose on day 1 and you'll get a dose 3 weeks later. So it's 5 weeks after your first dose, 2 weeks after your second dose. If you get the Moderna vaccine, that's 2 doses 4 weeks apart. So it's 2 doses 2 weeks after 4 weeks, 6 weeks after your first dose. If you get the J&J vaccine, it is 2 weeks after the single dose vaccination. So please know that people do get COVID after their first dose of vaccine before they're fully vaccinated. We have seen it happen. I've seen it happen in my family. So please be sure that you are following that important public health advice. We look forward to continuing to work to get vaccine out to the general public, and we'll work very, very closely with our community partners to continue this very important effort to get us to the finish line. Thanks.
Dr. Whalen, thank you as always, and great advice. And please, if you get the vaccine, wait. You got to wait for it to build up in your body so you can fend it off, and read the guidelines. If everyone in the room is vaccinated, you don't have to wear a mask. Everyone in the room has to be fully vaccinated and outside that window that Dr. Whalen just said for the vaccine to be effective. It doesn't mean that if someone comes in a room that's not vaccinated, you shouldn't put a mask on. You should, at that point in time. So, but again, we're getting there. So I just want to remind everyone we have our mental health support line available for everybody to please call 7 days a week. It is 8 a.m. to 5 p.m., 518-269-6634. And again, our 24-hour sexual assault hotline number, 518-447-7716. Just a couple quick notes. On Friday, we had our opiate task force meeting with Joe Rice from Motley and Rice on our opiate settlement. We will be settling in July. This is our, we're on fast track because of COVID-19. Courts, as you know, got shut down, pushed us back. One thing I just want to say to my team here in Albany County that made this possible, we were the smallest county at the table. When New York State decided not to fight this, when no one was there to fight for the opiates and the changes in the laws, we were. And I take a lot of pride on that. Being president of County Executives of America on a national level, we've gotten a bunch of counties together and we sued in federal court, and which is good. Our new Attorney General jumped on board. And for the settlement, the money will go to the state. It will be a win. It's just not going to come to the county now. It will go to the state of New York. So the counties in the state will be able to file documentation to get reimbursements for different things for people on opiates and everything else. But I was there to change the cohesiveness of all this, meaning that when you went to your doctor and they were just giving painkillers, I twisted my knee, here's some painkillers. I twisted my ankle. And we had to change that. We had to change the addiction and everything else, and the long-term effect it has on men and women that got addicted to this, women that were addicted through opiates through their pregnancy, kids with learning disabilities. I could go on and on and on. And I said to the federal judge, you can't put a dollar amount on someone's life. I can't. God help the people that can. I can't. So no matter how much money they give me, it's not going to change that situation. But what would change that situation will be the fact that if we change the way we prescribe drugs going into the future, how we monitor people's pain. I know there's people in chronic pain that need this. We're advocating for you too. We're just advocating this devastation it has had on every community across this nation. So it's good to see that this is going to happen. Unfortunately, our Attorney General, I learned when I was in Cleveland, Ohio with Dan Lynch, my deputy, that Schneiderman at the time settled with these pharmaceutical places, the Slacker family and the rest of them, for like $30,000. It was alarming. But this new Attorney General is on top of it. The governor is now involved with it, and again, it's not about the money, it's about the outcome and saving people's lives. So please stay tuned for that. You're going to see some good decisions coming forward in July. And again, please, every vaccine in your arms, one step to being closer. I don't know if Dr. Whalen wants to jump on this because you could better say this than I can. The fact is, don't wait for J&J versus the other vaccines, because we're seeing a lot of that, people saying, oh, you don't have the J&J, I'm not coming. If you can get an appointment and get a vaccine in your arm, they're all the same. But I don't know if you want to jump in, Dr. Whalen, to explain that better than me.
Sure. So the way that I put it to family and friends who are asking me about formulations, and I think the way that we should all look at it is the vaccine that's available is the vaccine that you should get. It really is a question of time now. So for people that can be vaccinated and are eligible to be vaccinated, I would urge them to get the vaccine that's available to them. I understand that a lot of people like the convenience of a single dose regimen, and I understand that. But the 2-dose regimen, the efficacy studies do show slightly increased data, but all of these vaccines do protect against hospitalization, severity of cases, and deaths. So they're all highly effective vaccines. And really, I would just advocate for people to get vaccinated as soon as possible.
Thank you, Dr. Whalen. Please stay safe out there.